This is another AI tool that I have put together, this time to help for medication and treatment appeals. And I think it's going to help quite a few. And just as important, it's not behind a paywall. Some of y'all may have played around with a few of the other tools that are out there now. And from what I've seen, the others either aren't that good, or if they are good, you have to pay to use them. But again, this one you can access directly without paying anything. So let's say that we're trying to get Skyrizi approved, but insurance is rejecting it and instead wanting the doc to prescribe Humira. Now, depending on the medications, if it's not clear to the agent, then it may ask if you would clarify what's the reasoning for prescribing this medication. And so here we're going to confirm that it is for psoriasis. Where this tool really shines is that in those situations in which you're trying to make the point that you or the doc really feel that the prescribed medication is the better choice, that's where this app is going to help provide you with the compelling reasoning behind your preference to prescribe that medication. So watch what happens here when we enter this. As you can see, it provides you with the evidence-based advantages of the prescribed medication with respect to these 4 categories: clinical efficacy, safety profile, quality of life and adherence, and guidelines and recommendations. And here you can see it even provides citations to each of those points. Now, just to be clear, although I work in derm, I've adjusted the settings for this to help even those who work in other specialties as well. So let's look at a non-derm example. We'll say Lantus was prescribed for a diabetic, but insurance denies it, and instead they're asking for Levemir to be prescribed. So here we're just going to clarify that the patient is diabetic, that's what we're treating, and here are the results. And then if you could use some assistance putting all of this into an appeal letter, then just say so, and it will give you everything you need, which you can then just copy and paste into Word or whichever other app you use. Now, speaking of this, let me show you something here, because within the chat window, it doesn't really look that pretty, but watch what happens when I copy all of this and then I paste it into Word. The spacing and the formatting, it's all there. It's just not visible within the chat window. So as you can see here, after we paste it in this example into Word, it looks good. So just know that when you see the results in the chat window, if you do want to create a letter with the information it provides, it will look better once you paste it into whichever app you use. All right, so I'll include a link below, but again, it's not just for derm. It's now configured to help with these types of appeals regardless of specialty. All right, hope it helps. Thanks.